is flu season, friends, and we are still dealing with COVID. That's why we have Dr. Delisha Pruitt, the medical director of the Saginaw County Health Department, to break it all down. We need you right now. There's so many questions and so many answers that we need right now. Okay, so we are talking about, we're in flu season.
Yes.
Right in the middle of flu season. We're hearing it's going to be a pretty bad flu season. Tell us about that.
Well, you know, this is the time of the year that respiratory illnesses are here. And we need for people to know that this is flu season. And we anticipate that this will be a tougher season. In the past, people were wearing masks. So we had less flu. And now that, you know, COVID is somewhat under control, we will see that people's flu, maybe even some of their resistance to the flu, you know, their immunity will be down a little bit because people haven't had flu as much in the past seasons. So we think this will be a rougher season. So we really encourage people to go ahead and get that flu shot so that they can have some immunity towards the flu.
I love it. And so COVID, it's still hanging around, Doctor.
It is.
Are we going to see another surge this winter at all?
We do anticipate that this will probably happen. If we look at our friends in Europe, they're having a surge over there, which kind of gives us an indicator that it'll probably happen to us. It happens to them first, and then it usually happens to us. So that's why we're encouraging people to go ahead and get that bivalent vaccine, the one that has the Omicron in it. So people, you know, a lot of people aren't like taking a hold of that vaccine, but we're saying this one has not only the original vaccine in it, but it has the Omicron with it, so that bivalent vaccine has both. So go ahead and get both of those.
That vaccine is so important. Now, is it possible, Doctor, I know I have this question, other people do too, is it possible to get flu and COVID at the same time?
It's possible.
Is it?
I mean, you could get flu and COVID. They're two different viruses, so you could have two different things at the same time. I mean, that would be unlucky, but is it possible? Anything's possible.
Anything, I hear that. So what are the symptoms that we should be looking out for the flu and then for COVID? Are there some different?
They're very similar. I mean, both of them will give you fever, cough, chills, malaise, which is this general feeling that you're not feeling well. The key is if you start having what we call cold-like symptoms, guys, stay home, first of all.
Thank you.
Don't spread your symptoms to other people. And we know when people come back positive for COVID, they'll go, I've been feeling sick for a couple of days. If you started feeling sick, stay home. Don't spread your symptoms to other people. And then get tested. There are home tests that you can do. We have free tests at the health department. You walk in the front door, there are free tests sitting right there at a table that you could just take home with you at the health department. Also on the 4th floor, there are even more tests that you can take for free at the health department. A lot of insurances pay for testing, so you can go to the pharmacy and get testing, but test yourself for COVID. But remember, there's more than COVID out there. There's the flu. Remember, you're not doing this by yourself. There are healthcare professionals that can help you. We can test for the flu, we can test for COVID, and we can distinguish between the two. This is important because there's treatment for the flu and there's treatment for COVID. So once we figure out what you have, you can get treated. If you're 12 and over, we can treat you for COVID, and we can treat you for the flu too. So we can help you out.
I love it. And it's so convenient and it's free. There's so many options out there. Doctor, for those people, and I hear it all the time, they are still hesitant about getting a vaccine. Please talk to us about just the safety of the vaccine and why it's important to help protect you and the loved ones and the people all around you.
Right. So there are different levels of prevention. So primary prevention is preventing something before it even happens to you. Vaccines are primary prevention. They are preventing before it even happens to you. What we want to do is get vaccinated so we don't even have to at least worry about the worst case scenarios of COVID-19. A lot of people feel like if I get the vaccine, I shouldn't be able to get the disease. What it does is damper the response of it so that it won't be as bad. So some people still get it, but it won't be as bad. Secondary prevention is if you get it, then we can treat you for that disease. And we have treatments there, but a lot of people's like, well, if I get it, I can be treated. You don't know. People respond to treatments in different ways. So let's do our primary prevention first, get the vaccine, and then if you get it, we can treat you with the secondary prevention. Once you get it, you get hospitalized. We do our best to treat you, but we're trying to do our best. Let's prevent it before we even get there. Do your best to do what you can to make sure you're your healthiest, best self. You know, people say all the time, live your best life. Your best life is preventing disease before it even everything gets here.
That is the best message that we can take today. And you
Yes.
did bring some information. I want to let the viewers know you have a drive-through vaccination
Yes.
clinic. It's Wednesday, October 26th from 8:30 a.m. until 6:30 p.m. It's at the former Sears Automotive Building at Fashion
Correct.
Square Mall. So please, please, please get out there and get that. Protect our community. Dr. Pruitt, you are such a busy person. Thank you so much
Thank
for
you.
taking time out of your busy schedule to come here.
Thank you for having us, and thank you
Yes.
for supporting Be Well Saginaw
Oh,
and being at our
yes.
event,
You are so
our
welcome.
walk and run.
I love it. Help it. I'm all about the help. Thank you, Dr. Pruitt. We appreciate you. And if you have any ideas on what you would like to see on our show, you can send them to us at 4 p.m. news@wnem.com. Just use the subject 4 p.m. News Spotlight.